Hello, welcome to my channel. In this video we will talk about intestinal permeability in general. Beginning, what is intestinal permeability, treatment of intestinal permeability with herbs, diet for intestinal permeability patients, causes of intestinal permeability, symptoms of intestinal permeability, treatment of intestinal permeability. What is the permeability of the intestine? The intestinal permeability is a medical condition that is still unknown, but it can be defined as a state of intestinal disorders resulting from the permeability of the digestive lining. Infiltration of the intestine causes penetration into the protective diaphragm and affects the process of filtration and absorption. What is a bowel infiltration, permeability of the intestine? When the lining of the small intestine or parts of it is weakened, it is no longer able to function as a separator between the contents of the gut and blood flow. When stomach infiltration occurs, this leads to penetration of the lining, which leads to the leakage of bacteria and toxins into the contents of the intestine through the bloodstream and into it, which leads to the occurrence of a variety of problems. Diagnosis of a permeability of the intestine. To detect the intestinal permeability, a solution of lactulose and mannitol is given to the patient and examined through urine. In normal guts, mannitol is absorbed from the intestine and no lactulose is acquired. If you have a porous gut, the lactulose gets absorbed and ends up in the urine. Diet for patients with permeability of the intestine. Food is a major cause of gastrointestinal diseases and thus intestinal infiltration. Reducing the intake of harmful foods and following a harsh diet, this works to treat and reduce stomach fluctuation. Stay away from foods that increase acid secretions, stomach irritation and gases. Early treatment can prevent such advanced levels of intestinal permeability to cause advanced problems. Starting treatment early will avoid many of these problems. By noting symptoms of leaky gut syndrome earlier, underlying causes can be identified and appropriate treatment initiated. Reasons of permeability of the intestine. There are many conditions and factors that can be the cause of intestinal infiltration. Intestinal permeability, the most important of these reasons is your exposure to pre-existing intestinal infections. And living in a bad environment with the presence of various pollutants. Taking certain medications, such as anti-inflammatory drugs, can lead to gastroenteritis when you are on these medications long. You are exposed to a state of chronic physical and psychological stress, which causes a leaky intestine to leak. Drinking alcohol, caffeine, bacteria, some preservatives and food additives all may cause a leaky gut condition. Therefore, you should pay attention to all of the following to prevent and protect against stomach leakage. Parasites, bacteria and viruses that we get from food and water may be contaminated. Deficiency of a digestive enzyme that works in a similar way to celiac disease and Crohn's disease. Eating excessively refined carbohydrates can worsen the condition of gastric emptying, intestinal permeability. Food preservatives and color dyes contain a large amount of toxins in the form of certain chemicals that cause intestinal leakage. Maintain the intestinal lining from irritation by reducing drinking coffee, tea and alcohol. Psychological state and exposure to anxiety and stress are a major cause of exacerbation of stomach leakage, leaky intestine. Symptoms of a permeability of the intestine. Having a gastrointestinal condition can cause many complications such as feeling bloated, tiredness and fatigue, joint pain, frequent gas, pain in the stomach and abdominal area, and cramps. Stages of a permeability of the intestine. The first stage of the symptoms of intestinal permeability. These symptoms include bloating, constipation, diarrhea, gas, heartburn, gum disease. The second stage of the symptoms of intestinal permeability. These symptoms include joint pain, headache, digestive upset, skin rash, fatigue and chronic fatigue, increased food allergy. The third stage of the symptoms of intestinal permeability. This stage includes these symptoms: colitis, arthritis, thyroiditis, severe skin disease. Treatment of permeability of the intestine. There is no clear and explicit treatment for the case of intestinal leakage, but there is what improves the condition of the digestive system in general and thus impressive results on the level of the leaky intestine. There are a lot of different herbs that can be used to treat flatulence. Many of these herbs have been used for many years to treat digestive problems in general, and the result is very effective. Treatment for permeability of the intestine with herbs. Peppermint tea. Peppermint tea soothes the stomach and gives comfort in it, and it also works as an antiseptic because it helps in the flow of bile. This tea helps fight bacterial infection and is extremely effective. Chamomile. Chamomile has been used for centuries to treat stomach and intestinal problems and is a very good remedy for relieving symptoms of stomach upset such as excessive gas, bloating, cramps and pain. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about permeability of the intestine, please visit my own site. You will find the website link in the description. Thank you.